How co-locating services in community spaces improves public mental health. Our communities are places where we live, work and spend time in. When times are tough, it is our communities that we perhaps turn to first for support and guidance. Across England, one interesting idea that is growing in supporting the mental health of communities is co-locating services. This means having lots of different services or opportunities to access different kinds of support within the same place, and this is now happening more often in community spaces. Our research team, including researchers from across England, including peer researchers from the McPin Foundation, those with lived experience, set out to talk to people that use and work within these co-located community services, so we can better understand how they support mental health. We did this by working with 5 places where mental health support was co-located in a community, such as a community centre, a library, an abbey, a cafe and a food bank. People told us there were 5 key ways in which the services worked. Previously, services had been spread out, unconnected and often hard to find. Community-based services understood the needs of local people and could work together to support complicated or multiple problems. People had sometimes had difficult experiences using statutory or treatment-focused services, such as those offered by social services or the NHS, or felt they would be judged if they used them. Engaging with mental health support through community settings reduced this stigma and made getting support feel normal. Co-located community services were delivered in friendly, respectful and informal environments, spaces that people felt able to come into and use without judgment. This didn't always work for those people experiencing more severe forms of poor mental health or crises, who might be best supported in more confidential spaces. When services were co-located, people didn't have to spend time and money travelling to different locations. Services were able to share resources, including funding. This meant that members of the community could easily use a range of different support services if they needed to. Sharing ideas, expertise, and sometimes finance and staff meant that co-located services were more efficient, well-known, and well thought of by local people. This made them able to secure funding. As such, they were able to grow and continue to meet communities' changing needs. This work showcased just how important community-based co-location can be for accessing mental health support. Importantly, these services supported people who were at risk of poor mental health, especially those who may have had negative experience with formal statutory services in the past. As such, community-based co-location is likely to be particularly important for reducing mental health inequalities. If you're interested in our recommendations for how to develop these services in your area, please use the link provided with the video. Our thanks to all our community partners and members of the public that participated in the research.